Hello students, welcome to this session. So today we are going to study about other hematology blood disorders. So other than anemia, leukemia, so blood disorders are polycythemia, spherocytosis, multiple myeloma, systemic lupus erythematosus, lymphoma, etc. First is polycythemia. So it is disease state in which hematocrit, volume of RBCs in blood is increased or hemoglobin concentration is increased in the blood. Symptoms are high blood pressure, formation of blood clots, can be headache, vertigo, dizziness, fatigue, tiredness, lack of concentration. Unusual bleeding, nose bleeding, itchiness after exposure to warm water due to histamine and prostaglandin release, numbness, tinglings in body parts, burning pain in hands, feet, reddish bluish discoloration of skin, also called as erythromelalgia. Complications can be because of the blood clots, thrombosis, heart attack, stroke, deep vein thrombosis, Budd-Chiari syndrome, hepatic vein thrombosis, pulmonary embolism. On examination, on physical examination, patient is plethoric, that is red in color, per abdomen, spleen and liver enlarged. Investigations, RBC 8 to 9 million cells per cubic millimeter. WBC and platelets are also increased, ES are decreased, PCV is increased more than 55%. So 70 to 80% is also there. So there are two types, absolute or primary polycythemia vera and relative polycythemia vera. So the first primary can be because of the increase in RBC. So it can be because of overproduction of RBC due to primary process in bone marrow. Myeloproliferative syndrome, chronic disease, low oxygen levels, malignancy, over transfusion of RBCs. Relative can be decrease in plasma volume, so decreased water loss in dehydration, burns, stress. Secondary polycythemia due to natural or artificial increase in erythropoietin, also called as physiological polycythemia. Conditions altitude related, hypoxia, cyanotic heart disease, sleep apnea, smoking, carbon monoxide poisoning. Iatrogenic causes can be phlebotomy, bloodletting and concentrated blood RBC transfusion. Investigations, RBC 8 to 9 million cells per cubic millimeter, WBC, RBC increased and ESR decreased, PCV increased, serum erythropoietin low. Treatment, phlebotomy, removal of blood from circulation, that is called bloodletting. Drugs can be aspirin, myelosuppressive drugs like hydroxyurea and oxygen therapy. Spherocytosis, it is a hereditary disorder, that is because of the problems with RBCs. Instead of biconcave disc, RBCs are round like spears, are called spherocytes and are more fragile than the normal RBCs. Causes, warm autoimmune hemolytic anemia, cold autoimmune hemolytic anemia, paroxysmal cold hemoglobinuria, hemolytic blood transfusion reaction, hemolytic disease of newborn, snake bite, hyposplenism. Pathology, molecular defect in one or more of protein of RBC membrane, so RBC contracts to spear. RBC has high osmotic fragility when placed into water. RBCs are more likely to burst than normal RBC. Symptoms, patient is having anemia, jaundice, enlarged spleen. Blood picture in PBS, spherical RBCs are many, reticulocyte count is increased, osmotic fragility test, it is increased, serum bilirubin is increased. Multiple myeloma, it is cancer of plasma cells, that is one type of WBC that normally produces antibodies. So risk factors can be obesity, radiation exposure, family history, chemicals, Epstein-Barr virus. Pathology, plasma blast proliferation leads to increased plasma cells, leads to abnormal antibodies deposited in various organs. Signs and symptoms, bone pain, fatigue. Complications can be amyloidosis, kidney disease, bone fracture, infection, anemia, hyperviscosity syndrome, bone lesions, osteoporosis. Investigation, blood, anemia, hemoglobin less than 10 gram %, PBS, rouleau formation of RBC seen, increased calcium more than 11 gram %, increased serum creatinine, urine, Baines-Jones proteins are present, protein electrophoresis of blood and urine, paraprotein, that is M protein band present, quantitative measurement of immunoglobulin A, IgG and IgM increase, beta 2 macroglobulin present, Bone marrow biopsy increased plasma cells more than 10% in the bone marrow. Myeloma cells, single nucleus with single nucleolus with vesicular nuclear chromatin and is eccentric and with abundant blue cytoplasm that you can see in this picture. Systemic lupus erythematosus. So it is autoimmune disease in which body's immune system mistakenly attacks healthy tissue in many parts of body. Causes can be genetic, hormonal like estrogen, environmental like female sex hormone, then sunlight, smoking, vitamin D deficiency, infections. In SLE, body's immune system produces antibodies against self proteins in nucleus. Symptoms can be fever, malaise, joint pain, muscle pain, fatigue, chest pain, hair loss, mouth ulcers, face red, rash on cheeks, that is called butterfly rash, photosensitivity, malar roche, that is on cheeks, rash on cheeks. Complications: heart, pericarditis, myocarditis, endocarditis, atherosclerosis. Lungs, pleurisy, pneumonitis. Kidney, painless passage of blood or protein in urine. Psychiatric disturbances: eyes, dry eye syndrome, Raynaud's phenomenon, fingers turn white or blue on cold. Investigation: blood hemoglobin decrease, WBC decrease with lymphopenia, platelet decreased. LE cell test can be done. It is LE cells seen in buffy coat of patients. In this picture you can see. Then anti-nuclear antibody test positive, anti-DS DNA test by ELISA or immunofluorescence positive, anti-Smith antibody test. Prevention can be lifestyle modifications, avoid sunlight, avoid activities that induce fatigue. So in this picture you can see female with the butterfly rash, that is rash present on the cheeks. Lymphoma, it is group of blood and lymph tumors that develop from lymphocytes. So two types: Hodgkin lymphoma, almost 10% cases, and non-Hodgkin's lymphoma, 90% cases can be seen. Clinically, enlarged lymph nodes, they are painless, fever, sweating at night, weight loss, itching, constantly feeling tired. Risk factors can be Epstein-Barr virus infection, autoimmune disease, AIDS, tobacco smoking. Investigations: lymph node biopsy, blood, bone marrow testing can be done. So in blood, bone marrow, you can see abnormal cells, that is Rhine-Sternberg cells seen in lymphoma. These are my references from which we can study. I hope this session you will find useful. Thank you.